Unnecessary deaths. 2026. Update. Part 2 of 4. The machinery of harm. Vaccine policy. Research. And real-world consequences. Part 1 established the structural conditions that produce preventable deaths. Part 2 examines 3 specific mechanisms through which those conditions are currently causing measurable harm. There is always a gap between a policy decision and its observable consequence. That gap is not accidental. It is structural. It allows decisions to be made and defended before their consequences become impossible to ignore. By the time the harm is measurable, the decision has already been institutionalized. This is the challenge of 2026. The decisions being made now will not produce their full consequences immediately, but the trajectory they are creating is already visible in the data. Vaccines are not simply medical products. They are the output of a system that includes research infrastructure, regulatory review, advisory processes, and public communication. Each element of that system depends on the others. When one is disrupted, the others are affected. In 2025 and 2026, several components of that system have come under significant pressure. Advisory structures have been altered. Review processes have been challenged. Scientific consensus has been publicly contested by individuals in positions of authority. The immediate effect is not always a formal policy change. Often, it is something more subtle. Uncertainty. And uncertainty has consequences. When confidence in the process declines, confidence in the product declines with it. And when confidence in vaccines declines, the behavior that follows is predictable. Uptake falls. And when uptake falls, protection falls. Not just for individuals, but for entire communities. This is not a theoretical concern. It is a documented pattern, observed across multiple disease contexts and multiple countries. It is now being observed again. Biomedical research operates on long timelines. The vaccines and treatments that exist today are the product of investments made years or decades ago. The tools that will be needed to respond to the next pathogen are being developed or not developed right now. In 2025 and 2026, funding for key areas of biomedical research has been reduced. Programs focused on vaccine-related research, including the mRNA platform that enabled rapid COVID-19 vaccine development, have faced disruption. Cutting research funding does not immediately increase mortality. It reduces the capacity to respond when mortality is threatened. It narrows the options available when speed matters most. Today's cuts are tomorrow's constraints. The third mechanism is the most direct and the most important to understand clearly. These are not projections. They are observations. Vaccination rates have declined in specific populations and geographies. Measles, a disease that was effectively eliminated in the United States, has re-emerged in multiple states, driven not by a failure of the vaccine, but by a failure of coverage. The relationship between vaccination rates and outcomes is not complex. Lower coverage produces higher transmission. Higher transmission produces more hospitalizations. More hospitalizations produce more deaths. The data does not require speculation. It requires only that it be read without filtering it through preferred conclusions. Vaccine policy uncertainty reduces uptake. Research disruption reduces future capacity. Declining coverage produces measurable harm now. These three mechanisms do not operate independently. They reinforce each other. Uncertainty about policy erodes confidence in science. Disruption to research reduces the credibility of institutions. Declining trust in institutions reduces compliance with guidance. The result is a system moving in a consistent direction. And that direction is toward greater fragility, not greater resilience. This is the pattern that unnecessary deaths identified. It is not a new pattern. It is a recurring one. The system is moving in one direction. The public health infrastructure was already compromised when COVID-19 arrived. In 2026, the same underlying forces are active, and they are reinforcing each other. Each trend, taken individually, can be debated. Collectively, they form a trajectory. Trajectories determine outcomes. The full analysis is available in Unnecessary Deaths on Amazon Kindle. Part 3 of this series continues on the Unnecessary Deaths YouTube channel, and the written analysis is available on the Unnecessary Deaths Substack. The next crisis will not create failure. It will reveal it.